Hello, and welcome to this training about stammering in children under 7. This training has been developed by speech and language therapists who work with children and young people who stammer. This training has been offered to you because you are a parent or carer of a child aged under 7 years who has been referred into speech and language therapy due to concerns that they are stammering. The aim of this training is to enable you as parents and carers to understand your child's stammer and to learn some strategies on the best ways to support them. So what is stammering? Stammering happens all over the world and is referred to using different terms such as stammering, stuttering, disfluency, and sometimes even bumpy talking. They all mean the same thing. Each person's stammer is individual to them and has different features. Stammering usually starts between the ages of 2 and 5 and can be sudden or gradual. It is very important to note that parents are not the cause of a stammer. There are often lots of factors which make a child more likely to stammer, which we will cover in this training. Parents often report that their child's stammer comes and goes. They may be able to predict when their child's stammer happens more, for example when they are tired, but the stammer may also be unpredictable and may naturally come and go at different times. Both boys and girls are likely to be impacted by stammering initially, but it's most likely to continue in boys. Stammering is more common than many people think. Around 8% of children will stammer at some point through early childhood, and around 3% of adults in the UK stammer. At this stage, it's not easy to tell whether your child is going through a temporary stage of stammering or whether it will persist through later childhood and adulthood. The cause of a stammer is not straightforward. This diagram shows that there are lots of factors that can contribute to a child's stammer and how they can be interlinked. This is called the multifactorial model or framework devised by the Michael Palin Centre. It's also important to note that there's no link between stammering and intelligence. Take a moment to look at a few examples within the diagram. Research says that a child's vulnerability to stammer is the result of a combination of factors, both innate within the child and environmental. Some innate factors may include a family link. Having a family member who stammers is seen as a risk factor of the stammer persisting. It may be related to a child's developing speech and language skills. They may be delayed or advanced in their speech and language skills, and this can have an influence on their stammer. And personality. Some children are more sensitive, some worry about making mistakes, some are impatient and want to rush everything at the speed of light, and others couldn't care less. These things may affect the way that they deal with their stammer. Some environmental factors known to contribute to stammers include having a fast-paced life. Most children cope well with busy lifestyles, but some find the fast pace of daily life and the need to adapt quickly and make their presence felt more difficult than others. A child who stammers will find it harder to be fluent when trying to speak quickly in order to participate in rapid conversations where they need to match other people's fast rates of talking. It's important then to consider this and realise when we need to slow things down. If a child needs to use complicated and lengthy sentences in order to join in, but they do not have this ability just yet, then this could increase their likelihood of stammering. Think about when it might be appropriate to simplify or reduce the complexity of the language you are using when in a conversation with a young child. The way that others respond to a child's stammer really makes a difference. For example, we can slow down our own rate of speech and make sure that we are matching our language level to theirs, so that things aren't too fast or too complicated. This can help a child feel less under pressure and therefore they may stammer less. The child's social environment doesn't cause stammering, but their stammer can be affected by what's happening around them. This might be positive, such as being around people who they feel relaxed and comfortable with, or might be negative, such as witnessing arguments or other unpleasant events. Stammering can be characterised by many different features, such as repeating the first sound, b-b-b-b-b-b, repeating whole words, mum, 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 can I have a drink? Or parts of words, but, and so on. Have a think about your child. Are they doing any of these? Take a moment to think about what sort of stammering characteristics your child shows. There may be other features you notice, such as where a child opens their mouth but nothing comes out, known as blocking. Or they may do other things that are not directly speech related, such as showing facial tension or extra body movements. These can sometimes occur as the child attempts to push out what they have to say, and might include stamping their feet or tapping their fingers. Often young children who stammer are not aware that they are stammering, and this can be a positive thing because it means that their stammer is easy and relaxed. We don't want to draw their attention to it. It's important at this stage to think about the causes of stammering, and there are strategies that we can use to adapt our interaction style to ensure that the child does not become anxious or feel pressured about their talking. It's clear that the way that you respond to your child's stammer is really important. Now we will think about some strategies that you can use. Don't tell your child to slow down or take a deep breath. There's nothing to suggest that taking a deep breath helps. It can even add to the struggle. Try not to interrupt your child mid-flow to offer advice such as slow down or start again. This is really unlikely to be helpful. Simply give them uninterrupted time to let them say what they need to. Often stammering happens more when the child is rushing. Slowing your own rate of speech down can help your child to slow down theirs, as we naturally match the speed of whoever we're talking to. So a good way to encourage your child to speak in a slower, calmer pace is to use that slow and calm pace yourself. This is more likely to be helpful than simply saying slow down. Slowing down your rate will also make you aware of how hard it is to slow down your talking. Simply being told to slow down is much less likely to be helpful than showing your child how to do this by doing it yourself. Avoid speaking for them. It can be very frustrating for a child to not be allowed to say what they want to. Even if you know what they are going to say, allow them to finish saying it for themselves. Time is a huge factor in supporting your child and their stammer. Being patient is key and one of the most helpful things you can do. We're trying to build confidence when speaking, so it's important to praise your child for things that they're doing well, and not just focusing on negatives. Focus on what your child is saying rather than how they are saying it. We want them to be able to get their message across and pay more attention to this rather than worry about how it's said. Although we naturally ask children questions, too many questions leads to extra demands on the child. Asking a child who stammers too many questions at once might overload them and result in increased stammering. Try to reduce the amount of questions asked. Remember to give your child time to reply. As mentioned earlier, stammering can increase if the level of language is too difficult for the child. Bear in mind that their language skills are still developing, and keep your language simple. Keep eye contact and try not to become distracted when your child stammers. We need to show them that we are listening. Imagine if someone just started to look away whilst you were mid-sentence. It's disheartening and adds time pressure, which is what we want to avoid. Encourage turn-taking in family conversations to reduce interruptions and make it less of a competition to talk. Children who stammer may feel an increased sense of urgency or pressure to get their words in, but when given time, for example, each person is given a turn to speak one at a time, they are much more likely to get their message across in a more relaxed way. If your child seems to be aware of their stammer, for example, they're really struggling or giving up, then it's okay to mention it in a thoughtful and sensitive way. For example, "That was a hard word to say, but well done, you tried your best." Remember to respond to any negative behaviour from your child in the same way when they are stammering as when they are not stammering. It's important to be consistent. Hopefully you will now have a better understanding of what stammering is, the causes and its characteristics, and have learnt some strategies to support your child when they're stammering. So what's important? Using the information from this training, you can start to make appropriate changes to your reaction to your child's stammer. We can also learn that it's okay to stammer and that the people around your child can support them. It would also be really useful to share this information with others around your child, such as wider family members or caregivers. There are changes that you can make to support your child and their stammer. Our recommendation is that you begin using golden time with your child. This is time for a parent to play one-to-one with the child. It includes reducing background distractions such as TV or radio or other noise, and giving your child the opportunity to take the lead. Give them your full undivided attention and comment on the things that they do well. Show that you are fully listening and present. For more information, see the Golden Time attachment in your speech and language therapy email. On this slide there are some examples of possible risk factors for stammering. Many of these factors interlink, and some could fit into more than one category. In addition to using golden time, take some time to think about a risk factor from the environmental box here in bold, which may be relevant for your child, and what you could do to make a change based on information we have gone through in this training session. For example, if you identify that your child often has to compete to talk around the dinner table, focus on ways to improve this, such as ensuring that everybody has a turn to talk and that interruptions will not be tolerated. Whichever area you choose, share with family and others around your child so that they can keep the strategy consistent for your child. You will also have received a blank version of this multifactorial model table in your email, which you can fill out to help identify your child's individual risk factors. So what now? To start with, implement your golden time and choose one other change. You can start to make gradual changes based on what you've learned in this training. If you notice anything that triggers your child's stammer, such as when their schedule is very busy and they become tired, think about making lifestyle changes such as introducing relaxing time to ensure they have enough time to unwind. If you still have concerns in 3 months, please call the number on the slide. We will then discuss the needs of your child and what future input could look like at that point. Thank you.